Welcome to our Facebook Live, where UC Davis Mind Institute experts provide information about neurodevelopmental disabilities. I'm Marianne Rush-Sharp. Today, we'll be talking about attention deficit hyperactivity disorder, more commonly known as ADHD. It's a good time to talk about this since it is ADHD Awareness Month as well. ADHD is one of the most common childhood behavioral conditions, affecting about 7 to 11% of the population, and it can and does continue through adolescence and into adulthood. Our guests today are both Mind Institute faculty members and ADHD experts who have cared for patients with ADHD and researched the condition extensively. Julie Schweitzer is a clinical psychologist and professor in the Department of Psychiatry and Behavioral Sciences. Welcome, Dr. Schweitzer.
Great to be here.
And Faye Dixon is also a clinical psychologist and professor in the Department of Psychiatry and Behavioral Sciences. Welcome, Dr. Dixon.
Thank you.
If you have questions, I encourage you to please post them in the comments, and our experts will do their best to answer them toward the end of our discussion. So I always think it's important to start with some basics. So let's begin with what is ADHD and what are some of the symptoms associated with it? Let's start with you, Dr. Dixon.
Okay, well, ADHD is a neurodevelopmental condition, and that means it's a condition that starts in childhood but can cover the lifespan. It's typified by challenges in attention, distractibility, impulsivity, but it's really a disorder where the person is having trouble regulating their behavior to meet the demands in their environment. So for a child, it might be sitting still in school. For a teen, it might be organizing themselves, waiting their turn, etc.
How is ADHD typically diagnosed? It seems like one of those things that you think, is this really a condition, or is my kid just have a lot of energy? So how is it diagnosed first, and what are some of the barriers to diagnosis? Dr. Schweitzer, would you take that one?
Sure, happy to. So the standard for diagnosis is a really thorough evaluation, and that means interview and rating scales with parents and teachers for children. And the clinical interview should be with the parents, but also some time with the child as well. And what we always say in ADHD, you don't want to just assess the ADHD symptoms, but you want to look across the board at other symptoms like depression, anxiety, thought issues, autism, and so forth, because sometimes those other symptoms mimic ADHD symptoms. So you want to make sure that you're not missing the boat, and it's really those other symptoms. But also, we know frequently those symptoms can co-occur. Also, learning disabilities are very common in ADHD, so that's something to be considered. Then there are standardized rating scales, and as I said, those should be done by the parents and the teachers. And there are some for the older children as well. There's some self-rating scales, and particularly with anxiety and depression, you want to get some screeners from the child themselves. There are more in-depth evaluations as well, such as testing, actual testing. And that's not as common anymore. And that's more, again, to rule things out. So IQ testing is nice to have because it can tell you something about the strengths and weaknesses and so forth, but it's not necessarily diagnostic about ADHD. Same thing with achievement testing, but it might give you a hint of how this individual is, if they're having challenges in the academic area, and if that's looking like ADHD, or again, it needs to be assessed. And again, as a diagnostician, we kind of get a flavor. So if somebody's very impulsive when they're responding in those tests, that helps us understand what they might be in their traditional environment. In terms of access, it's really hit or miss. And the problem is there are some people who claim to be really good at diagnosing ADHD and don't necessarily have the experience. Most pediatricians are really good at doing the rating scales and so forth. They tend to have less time to do a thorough evaluation. And if it's not a really clear-cut case, that's the time for them to refer to a psychologist or a psychiatrist. And, in terms of access, I really recommend people look at CHAD, because they can find on a CHAD organization persons who might be available. You can start with, again, the pediatrician locally will probably give you your best idea about where to find persons who can do a good evaluation. Faye, anything else you want to add to that in terms of access, in terms of finding people to evaluate?
Right. I was going to say, well, there are a couple other websites that are often helpful for people to look at in terms of both resources and perhaps places to find good evaluations. Looking at understood.org, which talks about ADHD as well as learning disabilities in children, and also childmind.org.
Great. And we will put those in the comments as well so that they'll be easy to click on. Sometimes it's hard to write really fast and get all that stuff down.
Of course.
ADHD seems like something that can present pretty differently depending on the person. You hear that not everyone has the hyperactivity aspect. What about boys versus girls? I feel like I've heard anecdotally that girls are missed sometimes in terms of an ADHD diagnosis. So are there some general differences that we can look at? Maybe Dr. Dixon, you start this one.
Yeah. So in the early years, boys are disproportionately more likely to display more hyperactive symptoms. And so that often results in earlier identification. So the teacher notices that at school, all the other kids are sitting in the circle, and here's a little boy for whom that's a greater challenge. Girls are more likely to display the inattentive form of ADHD, so often that doesn't get noticed until later in elementary school or perhaps in middle school, where the inattention is making it hard for them to focus academically or complete work accurately. However, by the time we get into late adolescence and adulthood, the rates for ADHD are really about equal for men and women.
That's great to know. Dr. Schweitzer, anything to add?
Sure. There's some really fascinating findings that are coming out about differences. And I just want to say, to start out, we need to know more about differences because it's really been underlooked at, and that's something our lab is really hoping to dive in on a deeper level. One of our findings was that in the teen years, girls with ADHD tend to be more irritable, and their irritability in later years leads to more impulsivity. We didn't find that as much in boys. And so that suggests that you should be looking to see if girls, particularly teens with ADHD, have irritability. And if they do, keep your eye on it and try to preemptively think about that to reduce potential impulsive acts later. The other thing that we're finding is an area where there are strikingly similarities between boys and girls. So we finished a study not too long ago with a large national sample. And we found that when we look at ADHD symptoms in early childhood, so an average age about 5 or 6, that girls and boys, when they were older, displayed higher rates of depression, anxiety, aggression, and oppositionality. Now, I think the myth was years ago that it was just the boys that displayed what we call these externalizing disorders with the aggression and so forth. Turns out girls as well are equally potentially have those challenges too. So again, for pediatricians and those people working with people with ADHD, you have to look at for girls as well as boys, just trying to think about how you can prevent that cascade of those later challenges.
We will try and post at least 1 or 2 of those studies that you referenced as well in the comments, maybe a little bit after this, but we will find them and get them in there because really good stuff. Thank you. Let's talk about fidgeting. So I know probably everybody fidgets at some point or another, but in people with ADHD, it seems like that's sort of a common thing, whether you're swaying or picking at your nails or chewing on pens or whatever it might be. And Dr. Schweitzer, you have actually done a great deal of research in the area of fidgeting that shows it can serve a real purpose. Could you tell us about how fidgeting helps people with ADHD?
Sure. So this is, as you mentioned, I've done a lot of work in this area because I've been fascinated with this because I've seen so many children do it, and I would watch them fidgeting, particularly when they were working on a puzzle or a difficult problem, and I'd see that they seemed like their concentration was really good, but their bodies were moving much more. And that was my first hint. We had a laboratory preschool where I saw this happening day after day, and I thought, this fidgeting is serving a purpose. So then we went about systematically studying it. And indeed, we actually found out when we were able to study it in adolescence that teens with ADHD, when they were moving their legs more, they actually had better attention when they were performing tasks. So we now have 2 studies where we're looking at that. We have one study, a formal study with UC Santa Cruz. This is a group of computer scientists who we're working with, or developed a fidget ball that has sensors in it. And we're doing artificial intelligence and machine learning analyses, so sophisticated analyses, looking at fidgeting with a ball, that this ball can detect different types of movements. So not just holding it, but stroking it, tapping, clicking, and so forth, and intensity of movement. And then we're looking at natural movements. So just moving your hands, moving your legs, torso, and so forth, because our bodies are with us wherever we go. So potentially, if you can use your body to help you maintain alertness and so forth, that could be a potential strategy. So what we're trying to do is systematically is look at how people use fidgeting with the ball or on their own, and to see if it helps them control their emotions and if it helps them control their attention. So this is the study that we've been doing now for about a year or so now. So we don't have results at this point, but we've always wanted to study this in children as well. And now that we've worked out some of the kinks and some of the methodology, we're excited to be launching one in children, hopefully. So we do have a crowdfund campaign right now going on, where we are trying to raise funds so we can design some stimuli and some fidget balls specifically for children, and to modify our tasks that work for children and help bring some children in to see if we can see how fidgeting works with them as well. And our long-term goal is that we can develop recommendations for individuals and on an individual basis, and say, okay, for you, what works the best is intrinsic fidgeting. And it may be that moving your leg works the best, but moving your hands, not so much. Whereas for another person, maybe it is they need something external. Maybe they do need a fidget cube or a ball or a piece of string or whatever. And then eventually we would want to have wearables where this wearable could cue them and say, okay, if you're in this situation where you're feeling a little anxious, this is what's going to work best for you. But where you're in a situation, you're not anxious, but you really need to focus and study, this is a technique you should try. So that's our long-term goal, is to develop strategies for people, non-pharmacological strategies that can boost the other strategies, as well as if they're on medication or using other treatments, but to use what we know already. And one reason I'm excited about fidgeting is that it's low cost. If we figure these things out, we can reach a lot of people, and there's a lot of people there who still have unmet needs. So yeah, so I'm hoping people check out our crowdfund campaign. I think we have maybe 14 more days or so left. I can't remember specifically. But we're hoping, our goal is $4,000 total. We're about 75%. We'll be happy to accept more funds. More funds we have, the more children we can study. But yeah, and I just want to be a little bit long-winded here, but I want to say our original study, we were contacted by media from all over the world, from Spain, from South America, Time Magazine, Washington Post, the Wall Street Journal. And they all said to me, they said, do these fidget spinners and this fidgeting with devices work? And I said the same thing to all of them. I said, it has not been studied systematically in the way we would like, and we need to study. And so that's our goal right here, is to do some science to actually see what works and what doesn't work.
Wonderful. It's fascinating research. And like you said, low cost. And well, not the research itself, but it could be a low cost intervention. Let's say that. But we have put the link to the crowdfund initiative. It's through UC Davis crowdfunding, and that is also in the comments. So if you're so inclined, please check it out. Okay. In case you're just joining us, we are talking with Julie Schweitzer and Faye Dixon of the UC Davis Mind Institute, and we're talking about ADHD. If you have questions, please post them in the comments and we will answer them toward the end of the discussion. I think we have a couple questions, so we'll look forward to getting to those in a few minutes. You just talked about treatments, and this is a great segue, which is, what are the most effective ADHD treatments? We hear about medication and behavioral therapy. How do they work? So let's start with you, Dr. Dixon. What works for ADHD?
Right. Well, certainly medication across the lifespan. So from very young children well into adulthood. And, we have lots of research, to support that. The behavioral interventions are are set up a little bit by age. So for the very young children, we're really talking about parent management and almost like training the trainer. We're teaching parents to recognize and manage symptoms at home and how to best communicate with their child's teacher or their sports coach. You know, as we segue into adolescence and adulthood, where more independence in life is expected, we're doing more things like working on executive function, working on organizational skills. And well into adulthood, we're talking about techniques such as cognitive behavioral therapy to address specifically the symptoms of ADHD in adulthood.
Can I follow up just to talk about what is happening in the brain?
Yeah.
Why do stimulant medications work? Because I think this is something that's confusing to some people.
Yes.
Why would we give children who have trouble with hyperactivity a stimulant, right? So what's going on there?
Excellent question. So ADHD medication works by increasing the chemicals that we call neurotransmitters that help control and regulate behaviors related to attention. And the regions of the brain that are responsible for that self-control are underperforming. And so medication helps those regions to function more optimally. And so that's where the confusion comes. Like, why am I giving my child who's having trouble being hyperactive a stimulant drug? But it's the stimulant drug that's addressing the underactivation in those areas of the brain that help us with self-control.
That makes so much sense. Thank you for clarifying that.
And actually, can I butt in there a little bit?
Of course.
And that's one of our theories about the fidgeting, is that the fidgeting actually also increases those same neurotransmitters and helps with that regulation, because those areas of the brain are underactive, they're under aroused, and so that fidgeting seems to stimulate those same regions.
What about other treatments? You mentioned behavioral therapy, but things like mindfulness, meditation, getting lots of exercise, making lists for executive function deficits. Is there research that some of these things work, and what should parents seek out? Dr. Schweitzer, can you give us some insight on that one?
Sure. So exercise is actually one area where there's starting to become solid evidence that it's helpful. So that's for children and for adults. So thinking about how to do that and make sure that your child has opportunities to have exercise. And I don't know about now, but over the years previously, before COVID, children weren't getting out a whole lot for recess even. Those periods were decreasing. So making sure that your child has opportunities to move, and whatever sort of activity they like, that's what I would go with. In terms of the mindfulness area, that's actually growing as well, becoming very interesting. There have been some small scale studies in adults showing that it's beneficial. I'm not so sure if it's this point in childhood where they're at, but they've modified the techniques for those with ADHD in clever ways. So they've made them more active, some of the meditation techniques, and the expectation is that you'd be doing the techniques for a shorter period of time as well. But the evidence base is growing in that area. And again, that's beautiful, because mindfulness you can do it anywhere, but having structure helps too. So if you have somehow a way where you have a commitment to doing it, or maybe you're meeting with somebody regularly, that extra accountability can help.
Yeah, that makes so much sense. It was mentioned earlier that ADHD commonly occurs with other conditions, anxiety, autism, Fragile X syndrome, and others. I'm wondering, what can you tell us about what that means in terms of diagnosis, but also treatment? You mentioned a little bit, I think, before, Dr. Schweitzer, about you have to parse things out, what's causing what. But in terms of the approach to not just diagnosis, but treatment, how do you deal with that, with the co-occurring conditions?
Right. Great question. We do, we work with so many different challenges at the Mind Institute, but I would say ADHD symptoms are actually quite prevalent in almost every disorder that we work with at the Mind Institute. We're running a number of studies right now where we're looking at the co-occurrence with autism, and so are other labs and other places in the world. And we're finding anywhere from, it's a wide range, but anywhere from 25 to 60% of people with autism may also have significant ADHD symptoms. Fragile X, it might be even higher. We just published a study where we're looking at training attention in children with Fragile X to see if that would help children with Fragile X and autism. And we did see that we found some nice gains in those populations as well. So one of the challenges when it co-occurs, one might be mimicking like the other, but the other might be neglected. If it comes to anxiety and depression, sometimes you need to be treating those simultaneously. When it comes with autism, what we typically find is that most of the emphasis is when children are young is really on the language and the social behavior, which makes total sense. But then again, on the other hand, if you can teach somebody to have better attention, we've always wondered whether that might also facilitate the language and the social skills. So that's an avenue that we have pursued before. And I think that's something that's been neglected in some of the communities to be thinking about that. Typically, as a clinician, when I started hearing from parents about autistic challenges and ADHD was more in adolescence. And after the autistic symptoms they felt were addressed, but the impulsivity and the problems with attention were emerging in the classroom setting, and they wanted help at that point. So it's mixed. Some of the same treatments we know do work. And historically, the stimulant medications may have more side effects, though, in autism. So it's there's a lot more work that needs to be done. Let's put it that way. And we'd be happy to work on. One of our goals, maybe after we finish the current Fidget project, would be to look at autism to see if there's the same effects as well.
Definitely a lot to juggle there. So, what should a parents? Oh, did you want to?
Oh, I was going to say, yeah, I was just going to add one point, which is one of the most commonly occurring conditions with ADHD is learning disabilities, because kids are often not doing well in the classroom, and we need to understand, is it ADHD? Is it really a learning disability? Or is it in fact both of those things? And so Dr. Schweitzer talked about in the diagnostic process that is where psychological testing can be really helpful, because parents will often say, well, if my child has ADHD, don't I need to do psychological testing? Certainly the psych testing piece helps us to answer the question about learning disabilities or other academic difficulties in relationship to ADHD, but not specifically as a diagnostic tool for ADHD.
Makes sense. So there might be some parents out there wondering, maybe my child needs to be evaluated for ADHD. What should a parent's first step be if they are suspecting that this could be an issue for their kid?
Right. Well, certainly one of the first places to start is with their pediatrician or their family practitioner. Pediatricians are all trained in how to diagnose and treat ADHD. The American Academy of Pediatrics has a wonderful toolkit for MDs. However, MDs have really short appointment times. And if there is a suspicion about a co-occurring condition like learning issues, like anxiety, depression, that might require a referral to a psychologist or a psychiatrist who has more time to do a more in-depth evaluation.
That makes sense.
Yeah, but pediatricians are a great place to start.
Do either of you feel that ADHD is often goes undiagnosed, that there are a lot of people out there who may have ADHD, but either it just hasn't risen to the point of feeling that they need a diagnosis, or it's just not been recognized? How common is that, do you think?
I mean, it certainly happens in kids, I think, who are very bright and who are doing well in school, because there may be a lot of inattention, there may be wiggliness, they are off task, but if they're doing well academically, they're getting A's on the test, there's a tendency to kind of push those symptoms to the background. And as kids get older and the demands get bigger. So it's not just listening to the teacher, it's working independently. It's having to do multiple different types of tasks at the same time. And then perhaps more of a breakdown starts to occur. And then people may say, oh, maybe those other symptoms that we were not looking at first and second grade because they were doing so well in school, maybe it's time for us to, pay attention to those. And Dr. Schweitzer may want to add some more to that, but one of the consequences of undiagnosed or later diagnosed ADHD is that kids then begin to not feel great about themselves. They begin to worry, they have anxiety symptoms. How come I'm having more trouble than the person who's next to me and I'm just as smart as they are, or they start to not feel good about themselves, start to have sad feelings, start to get excluded, by peers. So those are some of the outcomes if we don't recognize these symptoms and treat them, earlier.
Yeah, really important. Dr. Schweitzer, did you want to weigh in on that at all?
I think that's a great point that Dr. Dixon made, is that this lag in terms of waiting to intervene, just hoping that it'll go away. You can start with some low-level strategies, but just hoping isn't enough. And then you do get that cascade with problems with self-esteem and so forth. And that doesn't help anybody. So really, and then, there's different stages that Dr. Dixon talked about earlier. And as one matures and the expectation is that the adolescent or the young adult is expected to be doing things on their own, where before they had their parents doing things for them.
Yep.
And that's another time when you start to see these things emerge, these symptoms emerge, because somebody else was helping them, doing the managing and reminding them about what things needed to be done. And it's a spectrum. People have to recognize that it's not just you have it or you don't. Yes, you meet criteria on certain rating scales and so forth, but the truth is this occurs in degrees in people. And there are certain circumstances where it occurs more so than others. So there has to be some recognition of that. And there also is this interesting phenomenon where some people outgrow it.
Mm-hmm.
It's small, but some people actually do. It's not just that their circumstances get better. And so we've been trying to look at some of that with some of our brain imaging research too, is what happens in the brain between the adolescence and young adult years, when some people, they really just seem to compensate in some other way, neurally perhaps even. And of course, every parent wants to know whether their child will be that one, but in the meantime,
right,
they need to be doing what they can to help their child succeed too.
What percentage is it, Dr. Schweitzer, that does sort of seem to outgrow it? You said it's small.
Yeah, we don't really know. I mean, the theory has been 1/3.
right.
And I think probably 1/3 is what you see external change. So you no longer see maybe even much of the fidgeting, but what happens is a lot of that is internal fidgeting. So people running around in their head in terms of verbally. But I think I have actually seen some people where there is a percentage of people where, and again, we don't know. That's what we're hoping to get to with some of our data, is to try to figure that out. So what we do know, we've discovered over the past, 15, 20 years or so, is that even in typical development, the brain doesn't finish developing until people are in their mid-20s.
Right.
And it could be with people with ADHD is even a little bit later. And that's what we're hoping to look at and to see. So there's, so you have to, in other words, you have to look for a long time to see. You can't just look in adolescence. You have to really be looking in the 20s and maybe even later to see if there's that group where they no longer have the symptoms that are problematic.
Right.
Okay.
And there's also some thought that early treatment with medication and behavioral strategies, changes how the brain continues to develop as we move into late adolescence and adulthood, and that those changes may lead to the positive outcome of a reduction or a resolution in symptoms that were seen earlier.
Really
and Dr.
interesting.
Schweitzer, you might know about, there might be a study or two out there that has begun to look at.
So can't remember specific studies, but there were several years ago, there were some studies where they looked at 3 groups: children without ADHD, children with ADHD who are medicated, and children with ADHD who are not medicated. And they did see that there were changes in brain structure.
That was
started, this started looking, those children who had the medication, their brains look more similar to the typically developing children.
Oh, how interesting.
Right.
Wow.
Right. And what we're trying to follow up on is, does that structural change then translate into a functional change? And we don't have all that data yet.
Okay, we have a few audience questions. We'll be moving to those in just about 30 seconds. So if you have a question, please put it in the comments so we can get to it. I have one last question in this same vein about people not getting a diagnosis, perhaps, which is, I'm wondering if adults, parents specifically, whose children receive a diagnosis, if the light bulb goes off for them and you see that they tend to seek or question whether they also may have ADHD. Is that something that happens commonly? Either
We
one
can
of you.
both answer that
I
all
was
the
gonna
time,
say,
all the time.
Yeah.
Sadly, actually. So that's the situation exactly where a parent doesn't realize it until that point, and they say, well, I was like that in school.
Right.
And then sometimes what we find is, that's when a parent comes back and says, I procrastinated on these issues for years, but now that I'm a parent, I have so many more things to juggle and I really need help. And that's the time where they're ready for it. Maybe even if they had a hint or inkling that there might have been something going on, they were able to manage it. But being a parent, you've got a lot of simultaneous juggling that needs to happen and planning that needs to happen, and all those sorts of things that really are areas where attentional issues become a problem.
Yeah, and adults can seek treatment as well, right?
It's effective.
Okay.
Yeah.
Okay, great information for the whole lifespan here. I want to go into some of our audience questions. The first one is from a parent who has a 6-year-old son who is autistic and also has ADHD and having some trouble with academic tasks in kindergarten. And so they're wondering about what sort of evidence there is in support of medication for young kids ages 6 to 10 and any guidance, sort of guideline recommendations for using medication in that age group. Wants to take that one, maybe Dr. Dixon?
Well, certainly we have a strong, evidence base for the use of medication early. Now, the fact that this child has been co-diagnosed with autism, can present a challenge. And that's where you really need a specialist in medication, whether that's a child psychiatrist, a developmental pediatrician, who can look at how to optimize that. Because a child who also has ASD along with ADHD may respond differently to medication.
Okay, great advice. That makes sense.
And behavioral strategies too, educational and behavioral strategies. Yep. So it's not just medication, but home report cards, where the teacher fills out a report card on the daily report card, and then there's a reward given at home and so forth. Those sorts of strategies can also be helpful.
Yeah, and of course, it's always important to seek out a provider who can give you specialized information for your child's situation, obviously. Here's our next one, which is, what is the youngest age officially diagnosed with ADHD? So how young can children be diagnosed?
Typically, we think about a provisional diagnosis somewhere between the ages of 4 and 6, because there is a lot of behavioral development that's happening. And especially when I think about the pandemic and all the 3 and 4-year-olds who are now for the very first time entering a formal school setting where they may have done that earlier at 2, and they've never been in a classroom with a group of kids with a whole set of behavioral expectations. So, we think about that 4 to 6 age as kind of a provisional time to track, like, how long are these symptoms going on? How are they responding to behavioral interventions? Certainly behavioral interventions that may be happening in the classroom, but also perhaps behavioral interventions that parents are learning. But yeah, somewhere in that age range, we're thinking about that and tracking those symptoms over time.
Do you find that I'm throwing my own question here, sorry, most kids are diagnosed that early, or is it more common to be diagnosed when you're like second, third grade and you start to have to really study a little?
Do you want me to take that, or I'm happy
Yes,
to
I was
take that as
thinking
well.
it.
Take it.
Yeah, because typically when the academics kick in, parents, teachers may report they're a little active, they're a little wiggly, but fine academically. But that sort of first grade to third grade time is when kids are expected to acquire all of their basic skills in reading, writing, and math. And they're going to use those skills as they get into later elementary school to begin to do independent work. So often that second, third grade period where it's like, those early symptoms of inattention or hyperactivity or impulsivity are now beginning to impact academic acquisition. And so often that's the time when teachers and parents are start thinking, maybe this is the time for an evaluation. Maybe this is the time for some formal intervention.
Okay, that makes a lot of sense. All right, our next question is, which is better for prescribing ADHD medications, a psychiatrist or a neurologist? That's a good question.
Well, I think it really did. So I'm married to a neurologist. Who tells me all the time that he did not have formal training in ADHD, or if he did, it was very minimal. So it really depends. So psychiatrists have much more training in ADHD. Neurologists, it varies with the neurologists, but they run the gamut in terms of areas and so I think you really need to work with them to find out. Now, I can tell you, years ago when I was working with, when I started working with adults with ADHD, adult psychiatrists treating adults knew nothing about how to treat or diagnose ADHD in adults, because they don't typically get exposed to that until they're in their child psychiatry fellowship, which is after. Now that's different now. I think over the past several years, particularly Dr. Dixon has been trying to address that situation. She's been working very hard on that. So the psychiatrists, general psychiatrists, learn about ADHD earlier on. So that's it. And I gave a presentation actually to the Department of Neurology several years ago, and it was really clear that some people had no training and some people had exquisite training. So it's just really depends. When you're going to specialists, it really it's highly variable. So you need to ask them about their comfort level and area of expertise and so forth.
Okay, great. What about sibling co-occurrence? Now, I've heard that ADHD is highly heritable, right? That it tends to run in families. What about siblings? That's the question from our viewer.
So I don't know the statistics offhand, but exactly what you said, since it's highly heritable, I suspect, I don't know like the actual statistics about it, but I suspect it occurs more frequently. And even if it's not at the level of diagnosable, there may be people who have subthreshold kind of symptoms who wouldn't share it in the family as well.
Dr. Dixon, anything?
Yeah, and if you have a parent, one parent or both parents, the heritability rate is somewhere around 68%. I believe for siblings, it may be in the 30 or 40% range, but do not quote me.
Okay, we won't quote you, but you gave us a good gauge, right? Good.
Yeah, but we do have that information if, a biological parent, or two has ADHD.
Okay. Well, this has been wonderful. That is the end of our viewer questions. Thank you, everyone, for submitting those. We had some really good questions. And just a reminder that we have included links in the comments to the fidgeting study crowdfunding campaign that Dr. Schweitzer mentioned, as well as CHAD, which is a great resource, and understood.org, some of the other resources that were mentioned. And I will also throw in there Dr. Schweitzer has a very cool virtual reality study, and there's some other
Thank
interesting
you.
studies you may want to
We're
read
hoping
about.
we're hoping in January to start recruitment for that project.
Okay,
So
well
that's for children from 8 to 12, 8 to 13, I guess, actually. So yeah, we're looking forward to relaunching that project.
wonderful. Well, we'll stick that link in there too.
And do you want to put in a plug for our new adult study?
Please
Oh,
do.
of course. Thank you for mentioning that. Yes. So yes, our fidgeting study is ongoing right now. We're looking for persons between 18 to 35 years of age. We do a quick evaluation, so you don't have to have a diagnosis right now. We'll help do that. It's a fun study, and that's all about the fidgeting. And of course, people get reimbursed for their time as well. So that's at the Mind Institute. And then we have another study where we're looking at movement and how movement might help decision making, and we're doing that on the Davis campus. So we have both, but where people can participate in both. So yes, we would love for people to come do those studies with us.
Yes, and participating in research at the Mind Institute is hugely rewarding. Not only do you learn about yourself and or your child, but you also are contributing to the larger world of knowledge about these conditions. So we thank all the research participants that we have.
Definitely.
All right. So Dr. Schweitzer and Dr. Dixon, thank you so much for being with us today. So appreciate your time and your expertise.